Ladies and gentlemen, good afternoon to you all. My name is Khalil Osman, and I am a senior research fellow at the Center for Conflict and Humanitarian Studies. I am pleased to welcome our guest today, Professor Mats Gilbert, to our center here in Doha. Professor Mats Gilbert is a Norwegian physician, a specialist in anesthesiology, a senior consultant with the Emergency Medicine Department at the University Hospital of North Norway, a professor of emergency medicine at the Arctic University of Norway in Tromsø, and a humanitarian activist. Dr. Gilbert has a broad range of experience from international humanitarian work, especially in locations where medical and political issues emerge. Since the 1970s, he has been actively involved in medical solidarity work concerning the Palestinians. And he has served as a doctor for several periods in the Palestinian territories and in Lebanon. And that was on missions for his Norwegian governmental hospital or for the NORWAC, N-O-R-W-A-C. He has authored 2 documentary books, Eyes in Gaza, 2009, and Night in Gaza, 2014. However, many of us remember him as the doctor who appeared on television countless times during and after every round of war on the Gaza Strip. For over 40 years, he has been in active solidarity with the Palestinian struggle and has given his time and effort to assist in the medical responses to nearly every Israeli war on Gaza. I am also pleased to welcome you all to this lecture on the healthcare sector in the Gaza Strip and the heroic Palestinian response to the ongoing humanitarian disaster created by the Israeli forces. Many around the world continue to cling to the fallacy that the 7th of October 2023 was an irreversible turning point for the Gaza Strip towards the unknown. However, this is certainly not the case. The Gaza Strip has long been experiencing a slow death as a result of the Israeli policies. For years, many of us who have been closely following the progressively deteriorating living conditions for the nearly 2.5 million people living in Gaza, we have been warning that the Gaza Strip was to become uninhabitable, but to no avail. To us and to those living in the Gaza Strip, Israel's intent towards Gaza has always been characterized by genocide and a disregard for any notion of international humanitarian norms and laws, including the use of starvation of a civilian population as a method of war, which is explicitly prohibited under international law. When dozens of doctors in Israel signed a petition calling on the Israeli army to bomb Gaza's hospitals, we were enraged, but sadly not surprised. When the Israeli forces bombed the Al Ahli Baptist Hospital, murdering hundreds in one horrific and excruciatingly painful blow, we knew that this was going to be only the first of many attacks on Gaza's healthcare facilities. These deliberate attacks have taken Gaza's healthcare system out of commission, and only 10 of a total of 36 hospitals continue to operate despite the great challenges. According to the testimony of a Palestinian doctor who worked during this war in Gaza, the systematic targeting of the health sector and hospitals is an integral part of, and I quote here, of a policy of creating disaster by dismantling all necessities of life, from destroying sewage systems, water desalination plants, solar energy installations, and bakeries, to targeting ambulances and medical teams, intentionally martyring more than 280 doctors, paramedics, and nurses. These attacks contribute to Israeli efforts to inflict a disaster that is great enough to keep the ethnic cleansing project going even after the war is over. End of quote. This reality has rendered us unable to think of the day after. We are not afforded this luxury. For Gaza, the focus is on the present. How will we treat the insurmountable number of wounded and injured people? How will we tend to the psychosocial needs of the people? Once again, thank you for coming to this lecture, and I would like to point out that this lecture is being broadcast via social media platforms of the Center for Conflict and Humanitarian Studies and the Arab Center for Research and Policy Studies, and that we welcome any questions and comments from the honorable audience after the lecture. With this, I give the floor to Professor Gilbert.
Thank you.
Please.
Thank you.
You're welcome.
Assalamu alaikum, everyone. Assalamu alaikum, everyone. Can you hear me? Thank you for coming to the lecture, and thank you, Dr. Khalil, for your very nice and well thought through welcoming words and introduction. I agree to everything you have been saying. This is the backside of my most popular T-shirt. It says Kolona Gaza. And on Sunday, there was a big demonstration in my hometown of Oslo. And I taught the audience, the whole pack of about 5,000 people who came to demonstrate for Gaza and for ceasefire in minus 17 degrees, mind you. I taught them to shout Kolona Gaza. And I learned that in Gaza and in Al-Quds. And I think it is a good slogan. We are all Gaza. Because what is happening in Gaza now is not isolated to happening in Gaza. It is indeed an attack on every one of us. It is an attack on the platform for humanity and for a world which is regulated by the rules of humanity and by love and solidarity. I want to thank my hosts, Dr. Asmir Bishara, for hosting me together with Dr. Anas and the network, Al Arabiya network. Very generous. We've had some very fruitful days. And I, of course, also want to thank the Institute for inviting me. I will talk for about an hour from now, I hope. I always stretch the time, but be patient with me. Some of the images that I show will be graphic and painful, and I'm not showing it to be dramatic or to sort of dramatize the situation. I'm going to show you some of the realities that the people of Gaza are living every day, every hour, every minute. Not because I believe you don't see it, because you are an almost exclusively Arab audience, but because we need to relate not only to numbers, but to the pain of losses and the pain of pain. Today, of course, is a very important day. The proceedings are starting today, the hearings. I'm sure you've been following it in the International Criminal Court of Justice, in Hague. This is a comment from an American analyst and activist, Paul Laudry, and he says that he does not believe very much in the impartiality of the court, that there is a lot of haggling behind the the doors, the closed doors, and that the United States will be trying to influence the other judges in order to have a verdict that is not in any way stopping Israel. But I do think that without the international solidarity, this court hearings would not have been taking place today. And without the brave actions taken by the Republic of South Africa, which is also based on the massive solidarity demands among the people of South Africa, where I was happy to visit in October, November to lecture, that has been pushing also their government to take these steps. So these are very, I don't know what to say, it's very, I feel nervous about what's going on there, because indeed, if Israel is not giving a stopping order, these horrible things will continue. And it is not by chance that it was Republic of South Africa, of course, who charged the petition to the court. We all know the famous statement by Nelson Mandela that our freedom is incomplete without the freedom of the Palestinian people. And another quote by Nelson Mandela, maybe less known, he says that no power on earth can stop an oppressed people determined to win their freedom. And to me, and from my 40 years of experience working with the Palestinian people, I know a few other people in this world today who are more determined to win their freedom, even with the rivers of blood flowing in Gaza, than the Palestinian people. And I want to pay tribute to all of you in the audience who are Palestinian or have Palestinian roots, and I want to pay tribute to the pain that you are feeling and your losses, because it is, of course, always painful to be in the diaspora when such horrible things are happening in Gaza and in the West Bank. So I will try to cover this topic. Gaza is a massive, 100% man-made medical disaster, and it's met not with begging, not with pitiful cries of mercy. It is met with typical Palestinian heroism. Sumud, resistance, hard work, and never, ever yielding to the occupier's brutality. You can see on the bottom line here my Twitter account, which is pretty much filled up every day. The majority of the pictures in this presentation, I've taken them myself, and I have the permission, if there are patient pictures, to show the pictures to external audiences. This is from a previous attempt from the Palestinian people of Gaza to break the siege of Gaza. This is, of course, from the Great March of Return. Gaza exists. It is a hard place to live, but it's also a place that resists and has been resisting, like the West Bank, for decades, resisting a most brutal occupation, maybe in the world. And right now, Gaza is fighting for life. And I hope that all of you will reflect during my lecture on the question, what can you do? And what is it possible for you to do more? And imagine every one of you deciding today during this lecture that within the next week I will talk to 10 other people to try to make them active in the struggle for Gaza and for the West Bank. Because what we really need now is not less, but we need more activism, more research, more publishing, more demonstrations like the beautiful demonstration I saw with the students in the courtyard. We need more activism from the grassroots level, because at the end of the day, that is what is shaping and changing the world. And I'm very happy to be in Doha, in Qatar, because I know, of course, from my experience in Gaza, the immense support that Qatar has been providing to the Palestinian struggle. I don't want to portray Gaza as a place of misery and poverty and surrender, because it is in no way that. Gaza is, or was, beauty, love, humanity, It's also siege, hard living, resistance, and survival. And just to sum up by this picture that I took in September last year, or in 2022, I met these kids on the shores of the beautiful 45-kilometer-long shore of Gaza, strong, playful, laughing, despite 16 years of siege, and having bombings on their heads and their lives ever since they were born. You know the young age of the kids in Gaza. The median age is only 18 years, and they have been suffering a lot, but still they have this resilience and this sumud. So Gaza is, as a result of the siege, massive unemployment, massive poverty, huge medical needs, and de-education, attacks on the educational institutions. But Gaza is also, with bigger fonts, resilience and love. It is resistance, it is sumud, it is solidarity and hope. And the way we look at the situation, the dialectics of our understanding will determine our actions, I think. And too much of the narrative of Palestine is a narrative of suffering and misery and not managing. And that yields, not the right respect to the people. And I think that much of the NGO industry, the relief industry, is based on an imaging of the Palestinian people as a suffering people. Indeed, it is not only that. The siege of Gaza has been brutal. It's been lasting for 16, 17 years this year. Only 2 entrances, as you know, Erez and Rafah. Erez is now history. It's gone totally. But the siege has had a massive impact on all the determinants of health. And I will talk a little bit about the siege and what was the precondition when the bombing started in the beginning of October this year. Because the siege of Gaza has massively affected the life of the people in Gaza. This is just a video from my taxi when I go from Erez and down to Shifa Hospital last summer in June. You can see the massive effect of the siege, joblessness, poverty, trouble paying the education of the children. It used to be 11 hours of power cut every day. Now it is 24 hours since the beginning of October. The water was unfit for human consumption, 80 to 92%, depending on the studies. And 1/3 of the patients who needed to go outside of Gaza for medical specialized treatment did not get their permissions to go approved by the Israelis, by the COGAT. And since Gaza has not been allowed by the occupiers to have radiation therapy, it is estimated that 2 cancer patients have been dying every day in Gaza because lack of that treatment facility. Why shouldn't 2.2 million Palestinians in Gaza have radiation therapy? Why should they be denied treatment when a woman has breast cancer? In my country and in Israel, the 5-year survival rate for breast cancer in women is 95, 96%, meaning you survive it. In Gaza, it is barely 60% because exactly of this medical apartheid, denying them access to modern treatment. And what is the future of the kids in Gaza? Will the Palestinian children have to live 9 years shorter than kids in Israel due to the ongoing apartheid and the colonization of Gaza? The answer to that question is not, you don't have to guess, you can look at the science. And here are the numbers. These are the numbers for the Palestinians and the Israelis. You have the column to this column, let me see, yeah. So in the occupied Palestinian territories, in Gaza and the West Bank, the average life expectancy is 9 years shorter than in Israel. The infant mortality is 4 times higher. The under 5 years mortality is 3.5 times higher. And the maternal mortality, meaning women dying during delivery, and I believe it's the first week after, is 9 times higher in Gaza and the West Bank. What is this? This is the arithmetics of apartheid. This is medical apartheid. And these numbers, and that's a main point for me, all these numbers are known to the world leaders. And they've known them for the last 20 years. Because the research body has been increasing year by year with more and more scientific evidence of the disastrous consequences of this colonization and this apartheid system. So why has there not been any sanctions imposed? Any BDS or any political pressure? Well, I think that is one of the great questions of our time for the political scientists to try to solve. Anyway, the numbers as a medical doctor are staggering, and it is absolutely no problem to have access to these numbers. So these kids will have to expect almost probably now 10 years shorter lifespan than the kids in Israel. And that's a consequence of man-made political conditions, just as the situation in Gaza and the West Bank now is the decision of and the consequence of the Israeli politics. Let's turn to the man-made, 100% man-made disaster in Gaza going on as we are sitting here in a warm and comfortable auditorium. We have water, we have coffee, we probably had our lunch, we had our shower this morning. We can walk freely around in Doha without being arrested or bombed. All these elements of freedom and life support that we take for granted are stolen away from the people of Gaza by the occupying army and by the government of Israel. I know you know these numbers. I just want to update you on the numbers as of this morning. 30,000, more than 30,000 killed and missing within the time span of less than 4 months. 23,210 killed are the ones who came to the hospital and were accounted for. 7,000 plus are missing, and 58,000 are wounded. No medical system in this world could manage to handle 58,000 wounded, even intact, with electricity, with fuel, with light, with warmth, with medical supplies, with an unhurt and unkilled medical staff. So you can only imagine the mass casualty burden on the medical system in Gaza, and I will come back to that. Among the killed, and these are numbers from, you can harvest the numbers from OCHA, or from WHO, or from the Ministry of Health, or from the Information Office of the de facto government in Gaza. They are pretty much on the same line, and they have been validated. 10,000 children killed and missing, 7,000 women, 70% of killed and missing being women and children. We're approaching 375 killed doctors, nurses, paramedics, pharmacists, lab technicians, medical students, dentist students. 45 brave people from the civil defense killed mostly while they were digging, trying to find survivors. And I guess the last number is 112 journalists. None of them white, all of them Arab Palestinian journalists. I have not heard any outcry from the journalist community in the northern part of the world. Had this happened to journalists from CNN and from BBC and from the Norwegian broadcast, it would have been a massive outcry. What is this? Colonialism? Racism? Or just not caring? I think we need to dig deeper. And as I said about the numbers from the siege, the results of the siege, these numbers that I'm showing you have been available every single day, from OCHA, from WHO, to all the governments and the Minister of Foreign Affairs in the world. And this is from the November 16th chart from the health cluster of WHO, and you can see the staggering increase in number of injured and number of killed, day by day, by age, by gender, where it's happening, and how they were killed. They have known it all the time. They have known it all the time. The effects of the siege, the effects of the bombing, and they have done nothing to stop Israel. And if you look at the total number of fatalities between 1988 and 2023, before this year started, there has been a total of 26,521 killed Palestinians. This is before the last attack, and 3,027 killed Israelis. The ratio is for every Israeli killed, 9 Palestinians have been killed. This is what they call defense. These numbers also are well established in research, and it shows you that this has nothing to do with defense of Israel. It is all an attack on the Palestinian society and the Palestinian people. These numbers make us numb. I feel myself that I reach a level of sort of compassion fatigue it's called. I don't understand the numbers anymore. They don't make meaning to me, so I think the human stories are more telling and more touching to my own understanding of what is going on, as long as I'm not in there. I've been actually, by the way, in Cairo for more than 10 weeks trying to get into Gaza, but as you know, the Israeli occupation army has been filtering everything going in, humans, doctors, relief supplies, what is in the relief supplies, and we have not been allowed until yesterday. There was a Norwegian team finally allowed in. So humans are humans and numbers are numbers. Let me tell you the story of Yamin and his family. And I got this story from one of my very close colleagues. Let's call him Dr. K, a very skilled doctor who I've been working with for many years. Their home in Deir Bala was bombed in late December last year. My colleague, who gave me this story and shared the pictures and the videos that you will see, he was the uncle of Yamin. And the mother of Yamin was the sister of his mother. In this bombing, both the parents of Yamin and his eldest brother were killed, were martyred. And 4 were critically injured, 6 had minor injuries. Not a very uncommon epidemiology of injuries in such a bombing. The injured children were taken to Al-Aqsa Hospital, where my friend and my colleague works. And it was a 15-year-old with 2nd and 3rd degree burns. It was a 12-year-old with burns and crushed ankle, a 5-year-old with chest injuries and crushed elbow and forearm. And it was Yamin, 10 years, who had what we call a blast injury. The pressure wave from the explosion hit his body and shaked his lungs so much that he had difficulty in absorbing the oxygen from the lungs. We call it a lung concussion. So he was severely struggling to breathe, and he was put into the intensive care unit in Al-Aqsa Hospital. Yamin was staying there. He deteriorated more and more, and like all the war wounded in Gaza, his body got infected. Why? Because hospitals in Gaza are dirty? No. Because they have no water. Because water is essential to run a hospital. Clean water. And of course, they have no disinfectant fluids. They have no way to keep the wounds clean. And war wounds need dressing twice or three times a day. So he got infections in both lungs. And clever as they are, the Palestinian doctors, they cultivated the bacteria, and he had multi-resistant bacteria in both lungs. They tested the sensitivity of the bacteria because he developed a septicemia, a sepsis, which is a life-threatening infection in the blood. So my brother, Dr. K, he was forced to leave because in late December, these leaflets were dropped on their homes and in their neighborhoods. And you can see the numbers of the blocks that the Israeli occupation army are forcing to leave. You have all seen or heard about these leaflets, and they try to validate whatever they do by saying that we warned you. So Yamin stayed in the ICU, and the special antibiotics that he would need to treat the septicemia were not available in the hospital. They had it before, but due to the siege, they had run out. So the rest of the family, with the 3 injured siblings of Yamin, they had to leave their home, and Yamin had to stay in the ICU. But very caring as he is, my brother, Dr. K, went to see him and to tell him that they had to leave. And this is when he's taking farewell with Yamin, telling him that he will have to stay alone, but there is an uncle of the family who will stay with him. He's a nurse, a more distant relative, but he will not be alone. And they will call him, he say, they will call him every day with video call. And you can see that Yamin is completely awake. He should be alive. Because of the lack of antibiotics, the sepsis deteriorated, and Yamin died on the first day of this year, on January 1st. And I got the message early in the morning from Dr. K, and it was my start of this new year. So this death was 100% avoidable. His death was caused by several factors. Number one, the long-lasting siege of Gaza. He had had nothing but siege in his life, and the majority of the children in Gaza were malnourished, in negative protein balance, which is affecting your immune system, because you don't build immunity if you don't have a good protein diet. Then it was the bombing of his home, which was 100% avoidable. And it was a civilian home with civilian people, so it should have been protected by international law. Then it was his bombing injuries, the lung concussion, the avoidable infection had the hospital had water and electricity, and the siege had not blocked it all off, which is also an illegal part of the collective punishment. They would have avoided infection with these multi-resistant bacteria, and of course the unavailable antibiotics caused by the Israeli siege. So the family with the 3 injured kids had to move to the south, and this is Dr. K's video. They left their home. Dr. K's home was not bombed, but they were forced to leave. And what they see along the coastal road is this endless refugee camp. Not 1948, not Nakba, but 2024 or 23. And Dr. K tells me when I talked to him on the phone that it was such a painful travel because he could see the misery of all the other people being displaced forcefully. And I tell you this story also to tell you the story of one of the thousands of Palestinian doctors and how they stand by their patients and risk their lives. And this morning I got a message from Dr. K, now from Rafah, and I asked him, how are you doing? And he sends me this little video. And he's telling me that we are running out of anything to burn, to cook the water and to cook the food. So I'm actually saving the bandages and the paper that the bandages are packed in to use as fire. Because almost all the wood is cut down in Gaza now. You don't find any piece of wood anywhere. Because it's all been used to try to make fire and clean the water and cook the water and make some food. And he shows me how he's using the envelopes and the paper from the bandages that he has been using to treat the 3 not-so-injured siblings. It turns out used dressings are very nice in such cases since polydine, which is what the bandages are impregnated with, is flammable. Can you see how he's searching solutions all the time, finding solutions to situations where I would have given up long ago? And he says tools are also very important, a valuable treasure. And I'm using my surgical skills to repair the clothes, and I'm trying to take care of my cousins. That was Dr. K. That was the never, ever giving up medical doctor as a representative of the heroism of the Palestinian healthcare workers. Very few foreign medical teams have been allowed in. One American team came in a small week ago, and I got this message from him. No, first another film from Dr. K, showing how they are trying to make a bathroom in the camp where they are now. So they are trying to find tools and a toilet. This is where they're living now, the whole family with the 3 injured girls, and they have a small tent in the garden. These are their living conditions. And don't forget that more than 360,000 housing units have been totally or partially destroyed by the Israeli terror bombing so far. And that is, of course, one important reason for the people having to move to other parts. And then it is the forceful transfer, which is illegal according to international law. It's not evacuation. Do not call it evacuation. This is forceful transfer, which is illegal according to international law. Edward Said, he said in September 2003, "In fact, I cannot think of any other country on earth that, in full view of nightly TV audiences, has performed such miracles of detailed sadism against an entire society and gotten away with it." And I think this is an enormously fitting quote for what is going on in Gaza. It has absolutely no military meaning to deny children water. It has no meaning to deny the sick and wounded antibiotics. If your goal is military, but if your goal is to kill the whole population, of course, these are efficient tools. And that's what they want to cause. They want to cause epidemics. You've heard all the horrible statements. But I think this systematic way of taking away everything that could ease life a little bit, even under this hardship, is systematic sadism. I've been thinking that for many years, because every time I come to Gaza, and I'm there 2-3 times a year, I see new signs of this pressurizing of the life, the daily life of the Palestinian people, to humiliate them, to squeeze them, to starve them, to not let them have electricity. And now it is worse than ever and more systematic than ever. I heard from high-ranking sources in the WHO that they are systematically taking out medical equipment and medical supplies from the relief trucks. You know, the relief trucks have to go from El Arish and then east to Israel, and they are checked by the Israeli army, and they take out everything they consider dual use, which can be used for civilian and military purposes. And that's, you know, most of the things. This could be used to make a Molotov cocktail, so that's dual use. Don't let them have water in bottles. Surgical equipment taken out, external fixation taken out, very important to treat fractures. Anesthetics are taken out, anesthetic drugs. The only anesthetic drug, for those who know anesthesia, is thiopentone, which is not an anesthetic, only a sleep medicine. So it is very systematic, and I think Edward Said was very foreseeing when he said this. Again, I'm not going to bother you too much with numbers, but look at the starvation aspect. The World Food Programme and B'Tselem have come out with different reports on the food situation. And the recent report from the 7th of January, I think it was, from B'Tselem, said that by the 7th of February, the population at large in Gaza will reach the disastrous, catastrophic phase 3 or worse, which is hunger, which will make people starve to death. And the kids are already, of course, aggravating their situation by the lack of food. A systematic, genocidal attempt to eradicate the whole population, not to fight a military enemy. 400,000 have epidemic infections, mostly gastrointestinal, diarrhea and vomit, no toilet, no running water, everybody gets infected. Lice, skin disease, and of course, as I said, 100% of the war wounds are infected, and we don't know how many patients are dying from septicemia, probably by the thousands, like Yamin. 6,000 patients are needing to go out of Gaza for specialist treatment. A tenth of them have been allowed out to Egypt and evacuated to other countries for treatment. It's a massive remaining need in Gaza, and it's adding on 400, 500, 600 new wounded every day as we are speaking. They bombed the Turkish Friendship Hospital, where I've been working for the last 3 years in a very nice project under the leadership of the Palestinian healthcare to establish radiation therapy. They bombed it on the 30th of October with patients inside and with Dr. Sobiskeik, the medical head, inside. It had to be evacuated, and the days after, the cancer patients started to die from lack of treatment, of cytostatics and the other complicated cancer treatment that you need to have a hospital to administer. And you see the massive attacks on the Palestinian infrastructure, governmental headquarters, the schools and universities, the mosques, churches, archaeological and heritage sites. This is the epistemic of the eradication of Palestinian history and culture. Nothing shall be left that is Palestinian. Again, no military meaning to it, but the meaning of the epistemicide of Palestine as part of the settler colonial project. The water, again, we know the numbers, we know the research, and people in Gaza are now starting, or have been for weeks, drinking too salinated water because the siege has been blocking the water supply to Gaza, and they have actively turned off the water pipelines going in. So this is the message I received from my American colleague, who is very experienced. I cannot reveal his name because he risks, just like Dr. K, he risks prosecution or arrest, whatever. But he writes to me, the conditions on the ground resemble a scene in the post-apocalyptic movie. Picture you World War II Europe after liberation, Stalingrad after the Soviet victory, and Japan after the A-bomb. At night, without electricity, the streets remind me of a horror movie. Glowing lights and smoke in a dusty and crowded landscape of destroyed buildings. And he is a pediatrician, and he says there is a growing epidemic of respiratory syncytial virus, which is lethal to small kids, in particular if they are weak. And he had seen 75 under 3. And all these children, they live in polluted tents from the smoke, or in the streets, and the mortality rate is expected to be 2 to 5% from this lung infection, which is 100% curable and preventable. Those are the kids. Bathroom facilities is talking about, vomiting and diarrhea. The prospect of outbreak of E. coli, salmonella, and cholera is frightening. It's a very realistic threat. And he concludes, like I conclude, the only medical advice you can give in this situation is not send more doctors, send more tents, send more bandages. The only reasonable, rational, scientific solution to this situation is to stop the bombing immediately and permanently. It is to lift the siege immediately and get the supplies under full UN control. It is to open full supply of energy, fuel, medical supplies, water and food, of course, and it is to end the occupation of Palestine. Everything else will only be makeup and will only be treating the pain. And as a doctor, I'm not trained to treat pain, but to find the reason for the pain and treat the causative reason rather than just treating the superficial symptoms. So he says that this will be an expanding catastrophe. And he concludes by saying it is the most dehumanized I've ever seen. He's been around. And he says the siege is worse than anything he has seen. You know, Camp Moria on Lesbos, the Rohingyas, when they came to Pakistan. And the borders are hardened, and it is totally unsustainable. And the first step must be a ceasefire and the agent of change is the US, and he's totally right. But I think these two aspects of the US, the good US doctor and the good Palestinian doctor, are also showing us the level of heroism from the Palestinian healthcare workers, not giving up, not coming for a 2-week mission, but they have been working, they've been on call basically for soon 3 months now without leaving. And they have been mastering. They have been mastering in a historical way. This is from Shifa in October, and I repeat what I said to you, you are needed now. You are badly needed. Every one of you are needed. Your voice is important. We all have to voice because we are responsible for where this is going. If we're academic, or if we are janitors, or if we are students, whatever, we have to take our responsibility. And Samor Machel, he said, solidarity is not an act of charity. It is an act of unity between allies fighting on different terrains towards the same objectives. And the objective is freedom, justice, equality, and of course for Palestine, no occupation, no colonization, and freedom and a Palestinian state. So for me to go to Gaza, for me to do solidarity work, is the same as when I fight for the healthcare system in Norway. And what you fight for here, in Qatar. Solidarity is not an act of charity. And that's where the relief industry fails, because they want to be neutral, both sides, not take a stand. And I consider the relief industry as part of the colonial project to maintain control of the global south through maintaining control of knowledge and structure. It's part, in a paradoxical way, it's part of the structural violence, because the global south never gets the support and the energy and the resources to build their own independent systems, because the global north doesn't want independency. And make no mistake, I am no hero. I hate to be named a hero. These are the heroes. Dr. Sara al-Saka, the first surgical specialist in Palestine, female, just graduated actually after the bombing started. This is in Shifa. This is during the attack in 2014, during a lull in the bombing in the middle of the night. This is Dr. Marwan Abu Sada, fantastic surgeon. He has been the head of the International Cooperation Department for the first 10 weeks of this attack. One of my teachers, one of my leaders. I have a huge admiration for this man. This is Dr. Sobiskeik. He used to be the medical director of Shifa, British-educated surgeon. He recently retired, but he didn't retire. He took the leadership to be the medical director for the Turkish Friendship Hospital, which they have designated as the Gaza Cancer Center, collecting all cancer patients in Gaza in one hospital. Beautiful hospital, and that's where he was attacked and bombed during the attack late October. And they all had to evacuate. Happily, they all survived, but the hospital is now in shatters and cannot be operated. So I repeat, the heroes are the Palestinians, the medical staff, the volunteers, the leaders, and the whole people of Gaza, and of the West Bank, of course. And that is not very often portrayed in the Western media. So what are we looking for? Are we looking for suffering, or are we looking for strength? And where do we want to have our focus? This is Shifa, the early days of the bombing, 8th of November. And you see it's completely overcrowded. They don't have more beds. And that's, of course, bad, not to have beds. But they find solutions. They find a mattress. They treat him on the floor. And look at their concentration. Look at their intense focus to treat this wounded brother, another Palestinian. And the children coming in. Yes, it may look miserable, but when I look at this picture, I see mastering. I see control. I see innovation. I see all the different attempts to find solutions in situations that could seemingly be completely unbearable. They have a fan, the kids. They have blankets. Yes, there are two in the bed, but that's fine. They can keep each other warm. There are some drinks at the bedside. And there are pillows and carpets and some IV fluid. This is mastering. This is improvisation. But this cannot go on anymore, because now there are almost no remaining hospitals. Out of the 36, they have destroyed around 30. So the only way to solve this mass casualty problem is actually ceasefire. And here is another attack on the healthcare system. This is bombing very close to Al-Aqsa the other day. And if you note, people are not running away from the bombing. They are running into the bombing to save their fellow men, women, children. With great risk for their own lives, they do run into the smoke and the rubble of the bombing, very close to the hospital, and they immediately start the rescue work. They immediately start the rescue work. If this is not heroism, I don't know what heroism means. If this is not humanity, I don't know what humanity is. If this is not solidarity, I do not know what solidarity is. And you can see the numbers. Almost all the hospitals have been taken out of function. Not all of them are bombed. And that's an important point, because the Palestinian healthcare workers and the leadership in the Ministry of Health, Dr. Youssef Abarish, who I know personally very well through the last 10 years, fantastic leader. He says, we don't want field hospitals and tents. We want the Palestinian healthcare system to be re-established. We want the Palestinian hospitals to start working again. Turn on the water, turn on the electricity, turn on the supplies, and we're ready to restart the hospitals. They're not all that damaged. There may be an elevator shaft, there may be some holes in the walls, there may have been some fires, but we want to re-establish the Palestinian proper healthcare system. We don't want to be beggars in the international NGO system. And that's an important point for us to notice, because the next task for all of us, it is actually to rebuild Gaza. And that task will come very soon, and we must be ready. And you can see the amount of destruction of the healthcare system systematically. And somebody says, oh, this was unprecedented. No, unfortunately, it's not unprecedented. For the last 18 years, as I've been working in Gaza, I've seen during every bombing campaign, they have been attacking the hospitals and trying to destroy the hospitals. So that was the structure. Now the patients, the most common injuries in war are listed here, and I have discussed this list with my colleagues. First of all, it's burns, and burns need cleanliness, and they need to be redressed once or twice a day. Very many of the wounded children have burns. The second type of injuries are the shrapnel injuries, the small metal fragments hitting the body and making openings into the cavities of the body, the skull cavity, the chest cavity, and the abdominal cavity. And inside, these small devilish sharp fragments, the shrapnels, will cut open organs and blood vessels, and you have bleeding, and you have to do surgery to find and to stop the bleeding. Then you have the traumatic amputations, that a shrapnel is so big it can cut off partially or totally a leg or an arm. And you have the blast injuries, like Yamin had, where the blast wave hits you and shakes your inner organs, the pudding organs, like the liver, the spleen, the kidneys, and the pancreas, and make them bleed or have edema. And the compartment syndrome is when your extremities are hit by the blast from an explosion and you lose your circulation. And then the chest injuries, which are life-threatening very quickly, and the multi-trauma. And this is how it looks when there has been Israeli bombardment. This is what it looks in the Palestinian emergency rooms in the hospitals in Gaza. This one from Shifa, filmed by one of my colleagues, following one of the more than 2,000 bomb attacks. And you can see how quietly The healthcare workers are going to their work, systematically working, trying to assess who is the most needing, trying to do the triage, meaning the sorting of the patients, and do the life-saving measures, and then starting on the life-saving surgery. A massive task, and of course, with a staff that is themselves very well aware that the next patient coming in could be your wife or your child, your cousin, your auntie, your grandmother. And I've been there during bombings where I've seen my brothers and sisters receiving their own families. And painful as it is, they don't leave their position and their duty. The complications, now we had the injuries, the complications are bleeding, lung injuries, and infections, as we talked about with Yamin. And of course, the emotional trauma, the loss, the grief, and all the orphans that the Israeli occupation army has produced in Gaza on purpose. All these killed women, the 7,000 killed women, and all the other killed parents have produced a whole new large group of orphans. And of course, the pain of losing your children, I will not name him, but he lost his whole family in the bombing of their home. I'm not showing you these videos, as I said, to inflict pain on you, but I think one of the problems in understanding why the Israeli occupation and the Israeli bombardment and siege of Gaza is attaining so little political movement in the global north, where I come from, in Europe, in EU, and in my own government. It is that the media are filtering all the time. They are filtering the images coming, and they say, we have to protect you. Oh, you can't see this because it's too bad. No, we cannot show any dead people on our television screens. Why not? I know how to protect my children. I know how to protect my grandchildren. I know what they are allowed to see and not. I can turn off the television screen. But we need to see it. These are humans. And we are lied to by our media. I'm not talking about the Arab media, because I've been following your Arab media for the last 3 months. And it's a completely, qualitatively different narrative and image and reporting that comes out of the Arab media. Your media here, in Egypt, also in South Africa, of course, than what comes from the Western media. And this polishing and this lying to the public about what is going on is not because they want to shield us. They want to shield Israel. They want to avoid confrontation with the anger of ordinary people all over the world who will stand up and say, we don't want this world. And what these news organizations in the West cannot control is, of course, the social media, because TikTok and X and Instagram is flowing freely from the minute of the bombing. All these short videos, except from the ones I got from Dr. K, I have harvested them from the social media. They go straight into the 14, 15, 16, 17-year-old in the US, in Norway, in Europe. And they say, we don't accept this. We don't want this. And that's why we see a whole new generation of young people taking to the streets and shouting, free Palestine and stop Israel. And that is the promising thing, because the next generation will say, this is not the world we want to have. You can fight as much as you want, army to army, man to man, tank to tank, but you cannot kill 10,000 children and 7,000 women and ruin the schools and taking the water out of the mouth of the children. We don't want that. So we need to talk to our young people, our children and grandchildren and neighbor children, and we need to sit down and discuss how can we together make some sort of leeway in this situation. So, to conclude, the local Palestinian health workers are the heroes. They never give in, they never give up, they never leave their patients or their people. These are two of my exhausted colleagues during the 2014 attack on Gaza, 2 o'clock in the morning. It was Ramadan. We were, of course, fasting. Here we were waiting for the breakfast, suhoor, and I'm not a Muslim, but of course I fasted. I could not go around and eat and drink while my colleagues were fasting. And to work with war medicine, mass casualty while you're fasting, I tell you, it's not easy. And I'd like to end up by just saying that Israel, it's not a new thing that they are attacking civilians, children, healthcare, hospitals, schools, and universities, because they've been doing that all the time. Not only in Gaza, also in the West Bank. And the reports are stack high. The leaders around the world, they know about it. This is a father tending to his child who has been injured in a bombing during the Operation Cast Lead. I took this picture in the emergency room in Shifa. And this family togetherness, the family structure and the psychosocial support that the children get in the family is the most important tool of resilience and survival when it comes to emotional trauma. We have a whole new body of research, scientific research, particularly by some very clever Italian Palestinian research group, showing that the most important resilient factors for Palestinian children is the family, the culture, the faith, the psychosocial support, and the larger project, a free Palestine. All of these factors are crucially important to protect them against PTSD or whatever construction the Western medicine would like to call it. And they've been killing healthcare workers. This is Razan, who was one of the hundreds of healthcare workers trying to take care of the thousands, 35,000 wounded during the Great March of Return. And you know the Israelis, they shoot with the snipers. They shoot to the knees, to the ankles, to the elbows. They started with that, the breaking leg policy during the Intifada. The snipers, the 100+ snipers along the fence of Gaza, they were shooting systematically to the extremities. Not to kill, but to just tell those throwing a stone or using a slingshot, this is what happens if you dare oppose the occupation. Razan was killed while she tended to a wounded young Palestinian, 1st of June 2018. Nobody held accountable. Nobody held accountable. Nobody taken to the court. Israeli impunity, the most important moral problem in the world today. Because it is the Israeli impunity that, at the end of the day, has been lasting since 1948. They've never been taken to court, never been sentenced, never been held accountable for these crimes. Sashaya, August 2014. Same scenes as we see today. And this little Palestinian girl walking proudly towards her future, which is the situation today. So the endless attacks on healthcare, just a few of my pictures. This is from 2008, another ambulance shot to destruction by the occupation forces, luckily not killing any of the paramedics. I believe it was yesterday they killed 4 paramedics from Hilal, from PCRF, Palestine Red Crescent Society. This is Ayman, one of the most experienced paramedics I know in Gaza, 2014. He says, "We are targeted all the time. It's very dangerous." His wife being extremely scared every time he goes to work, and he works around the clock. This, of course, just during a break in the morning hours outside Shifa. Operation Cast Lead, if you look at the attacks on healthcare, to the right you have Al-Quds Hospital, which was burnt out. And then you have Al-Dorra Pediatric Hospital. I went to see that, which was bombed. And then it's the psychiatric hospital. So you see 16 healthcare workers killed, 38 wounded. We thought that was a high number, 15 ambulances, and you saw the numbers now. We're approaching 400 killed healthcare workers. So this has been the pattern of the Israeli army. Every attack, they are attacking healthcare. So all this debate about Shifa being a military command center is a smokescreen. Behind that smokescreen, they were dismantling Palestinian healthcare systematically. Why do they do that? Because it's a command center? No. It is because hospitals in any society are the temples of care and compassion and the solidarity of society. If you're sick or injured, you have a child with a high fever, or your mother has a stroke, where do you go? You go to the hospital. It's light, it's warm, it's full of caring people and knowledge, and you can be healed, you can be treated, you can survive. What does that give the population? It gives them safety, security, confidence. So by eradicating healthcare, the Israeli occupation army is systematically waging not only a structural war against healthcare, but also a very deep-rooted and evil psychological warfare against the feeling of security, in particular for the families with children, of course. This is, I say it many times, these are the heroes, and our friend here, this is Dr. N. I met him when he was a medical student. He's now one of the most skilled anesthesiologists in Gaza. I've known him for 20 years. He used to work in one of the biggest hospitals in the north. While it was bombed, I talked with him. Frequently, he sent me small voice messages that I could distribute. And his wife and his 5 children were evacuated or forcefully displaced to the south. Then we experienced together again the bombing during the 2014 attack. And now he, like Dr. K, had to leave the hospital, and he's now in Rafah working in a makeshift hospital. And he sent me this message from that hospital. Dear brother, we are evacuated from the Al-Quds hospital last Tuesday. We are in Khan Yunis, and we will start working in a field hospital during the next week. The situation is very bad. Disease, famine, fear, anxiety, lack of water. Gaza is slowly dying and awaits an unknown future. And I feel so much pain when I read this because I don't know how you feel, but I feel an enormous guilt that I cannot do more to support and be active in changing the reality for the people of Gaza. They stand so much alone, and they are so much left alone by the world leaders in the global north. And I'm not here to insult any of my Arab hosts, but I don't think the Arab leaders have been doing too much either. I know Qatar has done great things all the time. I know Jordan was the first country to break the siege and fly in by the order of the king himself and the Hashemite kingdom to break the siege. They have been flying in and dropping with parachute relief supplies. I've been working with them on that in Amman, but otherwise I think it's been far too little compared to the situation. Let me end by defining the difference between what I see as humanitarian medicine or relief industry and solidarity medicine. In solidarity medicine, you go when you're asked to come, when somebody says, we need you. You don't go there because you think they need you. That's part of the Orientalism. They don't even know what they need. Just like when Biden said, oh, these numbers are not right. These numbers are completely right. Somebody said that the Palestinian people is the only people in the world who has to prove their own death. The numbers are right. There was recently, a few weeks ago, a paper in The Lancet showing that the numbers from Ministry of Health in Gaza is actually a little bit lower systematically than the numbers from OCHA and WHO. You go when you're asked, and when you go there, you work in their system under their leadership. So when I go to Gaza, I report to the Minister of Health. I don't set up, so I'm done in a minute, sir. Please be patient with me, okay? Tamam? They organize, they lead, we find our place. We stand shoulder to shoulder in solidarity. I choose side with them, of course, on an individual basis. Any patient, if it was an Israeli soldier coming in, I would treat him or her exactly the same way as I would treat a Palestinian child or this Palestinian person. Of course, that's the ethics, that's my oath. But I have chosen side for the Palestinians, that's why I go there. And I document, I research, I publish papers and books, and that's part of the responsibility when you do solidarity medicine. And every time I come back, I have learned new skills, and to work with the Palestinian healthcare workers has been one of the greatest gifts of my life, because I've learned new things about human bravery, dignity, moral, and courage. I come from a massively rich country with oil and gas and all the rights you can have in life. We're obnoxiously spoiled and, we're living in the butter eye, as we say. But to go to Palestine and see how you can maintain your dignity and how you can stand up for your people and for your duties always makes me stronger in my belief that there will be a good world. And I treat patients together with them. I am not the one in charge, but when I have a patient, I may be in charge, like with this little girl. During the massacre of the Seshaya, she came in without her parents, had a deep cut in her leg. We needed to put in an IV cannula. I managed to give her a little ketamine so the surgeons could tend to the wound. And when we were done, she's not dead. She just fell asleep because we had anesthesia. She didn't have to do this with pain, as she probably would have to do now in Gaza. I tucked the dry cotton linen around her to avoid hypothermia, and I shared this peaceful moment with her, and she is the front page picture in one of the 2 books I've written about Gaza, Night in Gaza, which is a documentary about the experiences in Gaza in 2014. I end where I started in a way. I end by going back to Beirut 1982, my most important experience, I think, shaping my life. 82, the Israeli invasion of Lebanon, they wanted to kill the then Hamas, the PLO and the Fatah. They were going to kill the Fatah leadership and Abu Ammar, Abu Shahad. They didn't manage, but it was a fierce fight. And we sent medical teams to go to Beirut, and we worked here in a subterranean garage in the Near East School of Theology. This is me as a young resident giving war anesthesia to a fedayeen who we had to amputate both legs of in the light of a reading lamp. I am not the most important person here. Of course, this is the local team with Palestinian and Lebanese healthcare workers. But I learned a lot. And the most important lesson I got from Khalil, a young Palestinian boy. They bombed everywhere. They bombed hospitals, schools, psychiatric hospitals, ambulances, water pipelines, sewage pipelines. The attack on Gaza, on Beirut in 1982 was systematic and very brutal. Khalil lived in Sabra, one of the big refugee camps in Beirut. And one day in July, he went out of the house together with his mother, a single mother. He held her by the hand. They watched the F-16 coming in, the Israeli F-16 coming in high up in the sky, outside the reach of the Palestinian weapons. A bomb landed close to them. His mother was killed, and his arm was almost torn completely off. He was carried into the local Palestinian hospital, where a team of Norwegian and Palestinian surgeons had to amputate his arm. The next morning, he was sitting on the bed, and a British famous war photographer came by, and he took this picture of Khalil. And Khalil is as naked as a child can be. His left arm is amputated close to the elbow. Let's see now, here. His mouth is half open. His mother is killed. He doesn't have a passport. He is unwanted. All his belongings are in this bag. And it's easy to feel pity for Khalil. It's easy to think we want to take him up. He cannot manage. I did not meet him then, but I met him a week later when the Israelis were bombing also this hospital, and all the patients had to be evacuated in the middle of the night, some even during anesthesia. And I met the other side of Khalil, and I took these pictures. Khalil quickly regained the color of his chins, of his cheeks, and he regained control of his body. You know, I told you have to dress war injuries twice daily unless they will be infected. Morning and night you have to take off the bandages and you have to put on new bandages soaked in hypertonic saline. Khalil said, I want to do it. And I said, no, it's painful. I can give you pain relief. And he said, no, Dr. Mats, teach me how to do it. Teach me how to do it. And we taught him how to do it, and he dressed his own amputation stump morning and evening without anesthesia in the most diligent way. Not only did he do that, he was also a ray of sunshine into our rather dark field hospital. He went from bed to bed. He would comfort the other injured. He would sing Palestinian songs, get some water if we had water, tend to their pillows. He was like an angel sent from God. He became my best friend, and we spent whatever time we could have together. He had a little mouse, a sort of a pet animal that we played with, and he became my best friend. And I think Khalil is an important reminder of the resilience and the sumud that we see in Gaza and in the Palestinian people. The capacity to find solutions, the capacity to resist, the capacity to care for others in these difficult times, the capacity to restore function, and the capacity to learn. In short, the capacity to survive. And this is the sumud. And in our work, we need to strike the right balance between understanding the suffering and the strength. And it is, at the end of the day, solidarity and not pity that will strengthen the oppressed in their struggle for freedom and independence. And we can all take part in that struggle. And Khalil is a very telling example of that balance. Don't look only for the suffering. And that was the goal of my little lecture, to try to show you the magnitude of the heroism of the Palestinian people in Gaza and the West Bank, and for me, in particular, the healthcare workers. Thank you very much, and thank you. We can leave that. Just leave that. Come on. Thank you.
Thank you. Thank you very much, Professor Gilbert, for this. I mean, it's very as saddening and heartbreaking as it is interesting and moving presentation. We will now open the floor for questions, if you don't mind. Maybe I will start. I mean, you emphasized several times on the need to do more activism, to engage in solidarity. I mean, these are a little bit of broad concepts in a way. I mean, practically speaking, what can we do, us here in Doha or elsewhere, in details a little bit? If you can expand on this, please.
Thank you for the question. I don't think I have the playbook for what should take place in Doha or in Qatar. I think every culture and every place has to find out themselves according to their position, historical and cultural and political position. But I noted the demonstration with the students outside today. And I understand that is a regular feature, that they are having demonstrations. So I think the answer may better be answered. The question may better be answered by the young students you have. You already have a large group of activists. But my point is that within every field, we have a possibility to focus day by day on what is going on in Palestine right now, and ask ourselves the question you asked me. But I don't have the answer for you, because that would be very Orientalist. If I should come from Norway and tell you what to do in Doha, you know, I would be an idiot, wouldn't I? I've been in Doha 2 times. So I think we all need to struggle a little bit to find out what can we do. I think the most important thing maybe is alliances with the people of Gaza. They desperately need people from the outside paying attention and reaching out. If it is social media, if it is an invitation for scholarship, if it is a series of lectures and you invite some of the scholars from Gaza so they know that after this is over, they will be invited. Any sign of being seen, every sign of being heard, every sign of somebody else standing up for you is energizing and strengthening the resistance. I mean, use your imagination. It's easy to get in touch with people of Gaza. I was in Qatar and in Jordan, and we were discussing about what the needs were in Gaza, healthcare, needs, and how difficult it was to get the opinion of the Palestinians. And I just called my good friend, Dr. Youssef Abarish, on my mobile, and he answered, and I said, Habibi, there's somebody here who needs an advice. And I handed over the phone, and they were like, what? Can we talk to them? Okay, don't tell it, he was Hamas. So maybe it was dangerous. Joking. But the point is, try to make some contacts. How many of you know somebody in Gaza? Yeah, there you have a whole cluster. Maybe every one of you could give some contacts to 10 others, and then you can make a Doha network, social network with Palestinians in Gaza. The students can do it, the scholars can do it, the leaders can do it. And this is the opposite of being alone. And when we are alone, we are always weak. And that goes for all of you too. Don't be alone. Organize yourselves. I'm a member of the Norwegian Palestine Committee. I've been that since the 60s. And I'm very happy with that because I'm not alone. Discuss it in your department. That is my answer. Tamam? I'll be shorter next time.
Yeah, no worries. Questions? The lady on this side.
Thank you so much, Professor Gilbert, for this. I've been following you since the very, very beginning, so thank you very much for this great presentation. And I think the thing that stood out the most for me was the level of documentation that you've done. And I'm just wondering if you're aware of any documentation efforts happening right now, because, I mean, the scale of what's happening now is like beyond anyone's imagination. Are you aware of anyone who's actually documenting these medical atrocities that are happening?
Yeah, maybe we'll take a few questions. Other questions? Safe.
Thank you. Thank you, Dr. Gilbert. Here am I. Thank you, Dr. Gilbert, for your interesting, and you know, I cannot describe it. But I've seen you since so long time on TVs, and you're talking about Gaza, and sometimes you was talking from Cairo, and I need an answer. The answer you've got from the Egyptian government of not allowing you to cross to Gaza, because I think it's the Egyptian sovereignty over the Rafah cruise point, and they didn't take any answer. Did they take any answer from the Israelis or the Egyptian government? This is the one that they don't want you to be allowed to be in Gaza and to do your humanitarian work there. Thank you so much.
Okay. Any questions on my right? Yes.
Thank you. Very touching indeed, and it puts us all to the point of assuming our responsibilities. This takes me to a question. Several times we go and protest and do our own responsibilities to find deaf ears from the world leaders and from the people who take decisions. The Washington, D.C., New York City, London were all on the street during the Iraq War. Nothing changed. Maybe it made it worse being on the streets because they discovered us, they knew who we are, and then in the next episodes we're all chased. Does it take a global resistance? Does it take organization? Not only each one of us go and protest on their own ways individually, and in the absence of some global organizations that organize these things, how can this be done? You're from the northern sphere, and you have more freedoms to organize such. I don't know. I've seen the Greek leaders. I've seen some work in Europe around that. What do you have on that? Any ideas where that might go?
Yes. Documentation, yes, of course, there is. You can have this here. This is the... How many of you are reading the flash updates? Good. 1, 2, 3. Flash updates from OCHA. 4, 5, 6, okay? 10%. These comes every second day from you and OCHA. You can subscribe. It comes in your mailbox, and it's a complete sum up of the situation in Gaza and in the West Bank, with numbers and everything. These ones, are the infographic that comes with the same document. These two documents, you can print it out on your printer and you can put it in the coffee room in your department and it will give knowledge. A few years ago, I coined the term evidence-based solidarity. I forgot to take the slide. Evidence-based solidarity. Is solidarity based on numbers and facts? I don't mind flags and shouting and demonstrations and music and culture. I participate in that. But I have found more and more importance of the evidence-based solidarity, which means to read, to study, to know the numbers, and to do your own research. So yes, there is documentation going on, and bear in mind that the Palestinian Minister of Health in Gaza was documenting every day the numbers in their infographics for the first 4 weeks, and then the Israeli occupation army bombed the whole health information system. But still they managed to update the numbers at least every day. So yes, there are numbers, yes, there are ongoing studies, and yes, it's at your fingertip. So I'll give you this right away, and you have it already, so find the web page and subscribe.
Yeah, I do know it. I am aware of it, but I was more touched by the stories.
Oh, the stories, yes, yeah.
What I'm really focusing on is the stories. So
Sure, yeah. I am a storyteller. When I teach in my medical school, I always have patient cases because I think the case-oriented, the narrative didactic is always more appealing and touching, and the students remember. And then I sneak in the numbers and the statistics and the p-values, you know. So yes, we need to tell more stories. We had a very good meeting with the whole staff of Al Arabiya. And we discussed this, the difference between numbers and stories. And when we tell the stories, we should have the names. We should have the family. We should know the people we see or listen to. Because everything else is a colonial way in a way to handle people in the global south. So yes, more stories. I don't know of any story bank. But these stories are available on social media, all of them. And often with a byline and with names. Second question was about the Rafah. I mean, it's no secret. Rafah is controlled by Israel. Full stop. Every list of teams, every list of the names of the teams going into Gaza now, from ICRC, from WHO, from Norway, wherever, these lists are vetted by the Israeli army. And if the Israeli army doesn't want somebody in, they just put a red line and you're not getting in, or the whole team is dismissed. I am not allowed to go in. Why do you think? Because I'm a bad doctor? No. Because I don't know Gaza? No. Because I am an anti-Semite? No, because I'm not an anti-Semite. I'm not a racist. I support any Jew who's being prosecuted or beaten up in the street. I will go between him or her and the perpetrator. I'm an anti-Zionist. And I'm against the occupation of Palestine. I'm against the colonial project. I'm against the killing of the Palestinians. And I see it as my duty to document it. They don't like that, so they don't want me in. That's why I'm sitting here, by the way. So the question was, how can we organize, my friend?
Dr. Fadi.
Dr. Fadi. My city is Tromsø. It's the northmost university city in the world. It's on the top of Norway. We're close to the North Pole. And guess what? We have been twin city with Gaza City for 20 years. Why did we become twin city? Because we had a solidarity committee. How did we make it? We proposed. I don't know how many years, 5, 6 years. We proposed in the city council. And finally, the city council voted, yeah, we're going to be a twin city. And the last 4 mayors in my city, we have 4-year period. No, the last 5 mayors. They were summing up when we had a celebration of 20 years as Twin City. And all of them said, conservative and social democrats, they said it's been a blessing to our city to be Twin City with Gaza City. Why? Because their culture have enriched us. And we have been able to use our richness to support their culture and their struggle. So it's been a mutual benefit. And after the attack that started in October, there was a massive, immediate attack from some right-wing politicians that now we have to cut the Twin City agreement with Gaza City. We cannot support the terrorists, blah, blah. It was rejected because all the politicians, right to left, not the extreme, but the standard conservatives, social democrats, they said, you don't leave your friend in times of hardship. This is a people-to-people. This is not a political-to-political friendship. This is a people-to-people friendship. So the Twin City Agreement stands tall. Our mayor called the mayor of Gaza City. When his son was killed, he was a famous photographer, the son of the mayor of Gaza was killed. Our mayor called the mayor of Gaza and gave him his condolences and his support. Well, heavily attacked by the right, but the people of Tromsø said, of course, of course. So, Twin City is a good thing. We have had many projects with Gaza, cultural project, music project, filming and so on. And I think what we have seen during this attack is a growing global movement to support Palestine. This last Sunday, it was the Global Day of Demonstrations. Did you know that? Yeah. That's why we had the demonstration in Oslo. All over Norway, we had demonstrations. I think we need a global movement. But the Palestinians already started it with the BDS. And the BDS movement started in Palestine by all the walks of Palestinian society. Labor unions, political parties, every part of the Palestinian society organized and asked the world to join in BDS. And BDS is boycott, divestment and sanctions. The BDS movement is probably the most powerful political tool we have. So the more people who join into that movement, the more scared are the Israeli rulers. And this morning, there was a poll in Norway that was published saying that almost 50% of the Norwegian population are in favor of boycotting Israel. That's massive. That's actually the majority. And why was it that EU and US and everybody were boycotting and sanctioning Russia when they invaded Ukraine? Why can't you use the same political peaceful tools against Israel when they are not only invading but doing industrial killings in Gaza? So we need to use the tools we have already. Local organization, more knowledge, evidence-based solidarity, seminars and meetings, gain the energy of the young people, make connections with people in Gaza, and join the global movement for a free Palestine. That's my answer. Tamam?
Thank you. Other questions, further questions? Sam?
You are very disciplined, I have to say. When I lecture in South Africa, they're standing on their chairs and shouting. You're very disciplined. I put on the suit. It's the first time I had a lecture in a suit since my dissertation 150 years ago.
Okay, thank you. How does, over here.
There, yeah.
How does the solidarity or the solidarist approach to emergency medicine, how is it compatible with the humanitarian principles?
I think, as I said, on a patient-to-patient level, I am always totally neutral. Okay? That's my obligation as a doctor, as a healthcare worker. That's my moral base and my ethical, we swear, not swear, but we sign a sort of a contract with the state when we become doctors that we should apply these ethical principles. So for me, every patient I see, I will be on the side of the patient and do my very best in a neutral way to support the patient and the family. The solidarity medicine, I am only one person, so I can only be one place. Now I have to choose where do I want to be. Do I want to be in Israel? Do I want to be in Norway? Or do I want to be in Gaza? These questions will have different answers depending on how I consider my role as a healthcare worker. Virchow, the famous German pathologist, he said that the doctor, he lived around 1890, and he was the first the first professional doctor who organized public health as a specialty. He said the doctor should be the advocate of the poor. And he also said that medicine and politics are the same things in a way, because medicine and public health is all a matter of how society is organized, how much division there is between poor and rich, how the good things in society is distributed, if people have access to water and food and safe work and nice payment and a living a house and safety for the children and healthcare. That is what determines public health. It's not helicopters and operation rooms and heart surgery. It is basic living conditions. And the doctor should fight for good living conditions, choose side with the people. That's why I'm a political doctor. I think every healthcare worker is in a way a small politician in their work, in their choices. So to me, solidarity medicine is no different from humanitarian medicine. And I don't mind being called a humanitarian. I take that as an honor. But I disagree with this notion that medicine is neutral. Because if medicine is neutral, we are placing ourselves outside of society. If medicine should be neutral and tries to be neutral in Gaza, you go to Gaza, you clean up the blood, you patch the wounds, that's fine. That's important for each individual patient. But if you don't tell the world about your experience and what you have seen or document it or write a paper, the situation will not change. And as a doctor, I'm trained to treat the causes, the root causes of illness, disease, pain, and not to treat the symptoms. So I have to work actively to uncover the oppression of my patients, i.e. the Palestinian people. I have to work actively to point to solutions. And in my opinion, you may disagree, in my opinion, the solution is an immediate ceasefire and an end to the occupation. That's a long-term goal, but the short-term goal, why I'm here, why do I talk to the media in the Arab states? Because my little voice may add a milligram, a nanogram of political pressure towards ceasefire. And maybe one or two of you will be inspired to do some more solidarity work. That's part of my doctor job. Was that an answer? Or do you want to follow up? It's an interesting discussion. I can't see you.
I think there you have a clear agreement maybe that humanity would be the central principle that's common to both the solidarity and the pure humanitarian principles, and this re-evaluation of the humanitarian principles. So I guess you're suggesting an abandonment of neutrality as a central principle and a narrowing down rather than a expansion. So in the last few years with the rethinking of the core humanitarian principles, there's this sort of debate between whittling down and narrowing the list of core humanitarian principles on which we could agree, or expanding the list. I guess also part of the question, if I was to continue, would be, does the solidarity approach sort of, is it additive in taking and adding any new principles which you might suggest in this growing list that people are suggesting? For example, humanitarian subsidiarity is being proposed as a principle which sort of gets around some of the issues around localization and decolonization of humanitarian action. I just wondered also, is there any additional principle which maybe could be in consideration in this larger plural discussion around humanitarian principles and rethinking the relevance in this changing world of humanitarian action?
Thank you very much. It's a very good insert, and I'd like to complicate it even more by saying that if the humanitarian principles were global and universal, applicable to all, then we could say, okay, let's all work on that platform. The problem is you have an additional factor which you might call structural violence, which is very prevalent in the colonized countries, meaning that these humanitarian principles do not apply to everyone. Look at Gaza. We have the Declaration of Human Rights, of Children's Rights, we have the Geneva Convention, we have the Hague Convention, all of them are inefficient in controlling what the Israelis are doing to the Palestinian proper, the people, not the fighters. So we don't have humanitarian principles in Gaza. If we had that, if those were enforced in Gaza, we wouldn't have 10,000 killed children. We wouldn't have the epidemics of infections and the homelessness. The problem is that for some people, the humanitarian principles are valid and upheld and enforced. Not for everyone. And that's one of the global problems we have. So I think that we need, as a precursor, as a starting point, to try to equalize the access to humanitarianism. We need solidarity first, because we need to support the struggle for equality and against colonization and against apartheid. Because also within the apartheid consequence in a society, you will not have access to these very nice and very, for me from Norway, very comfortable humanitarian principles. See my point? We don't have to agree, but my point is that it's not enough to declare humanitarian principles as a platform, alone, the only platform, for my work at least. I need to go beyond that broad definition and find out how can I actually contribute to the achievement of humanitarianism also for people in the global south, or in Gaza for that case. Yeah.
Thank you. Thank you very much, Professor Mads Gilbert, for this very interesting presentation.
Shukran Iktir, and thank you for inviting me. If anybody wants the last